Hey, everybody, welcome to Let's Talk About Pools today. And our podcast episode number 2 today is going to be with Craig Sears from Sears Pool Management and Consultants. And we're going to be talking about COVID-19 here and now in public swimming pools. So, looking forward to this episode and hope you all enjoy it too. Welcome to Let's Talk About Pools today. And today's episode is I've got Craig Sears on with Sears Pool Management Consultants. Hi, Craig. How are you?
I'm doing great, Lauren. Thanks for having me on.
And thank you so much. I'm so excited to have you on today because what we're going to talk about is COVID-19 and aquatic facilities, and especially right now because we're seeing an increase in cases, aren't we, Craig?
Yes, we are, unfortunately.
So I thought this would be a great topic to talk about. Parks and Rec in my audience, especially. I have a lot of Parks and Rec in my audience, as well as pool companies, property managers. So I think this will really apply to everybody across the country is going to be listening. Hopefully they are listening. And give them some new updates if there are any with COVID-19 and what's going on. So we're all concerned about COVID-19, of course, and right now we have an increase per what the CDC and Dr. Fauci expected, with flu season and people going indoors and that indoor ventilation.
Yeah, I think a lot of it is schools starting back up again.
Yep.
Unfortunately.
So, of course, they're going to go to aquatic facilities, indoor, outdoor, doesn't matter. So we'll have spread at our aquatic facilities still if they're open. So, right. Health department, it was so surprising when I was working there as a pool inspector, how many calls, how many emails we got in the beginning of this. We did not expect aquatic facilities to be such a big thing with COVID-19 that we had to draft whole memos and information to give out to the public in our county. Can you hit on a little bit with that, Craig?
Yeah, I think it was the same here in Georgia where I am, and everybody wanted to know. I think, we're in the Sun Belt and everybody loves their pools. So if you get an inkling that your pool might not open, you get a lot of people suddenly very interested in what's going on. And that's obviously what happened, this year. So I think, yeah, our health departments were also flooded. And we tried to take a collaborative approach with them to say, phrasing the question in the right way, what can we do to open safely? Not suggesting that we shouldn't open because that really wasn't determined yet. And I think a lot of facilities opened successfully this year and have proven that it can be done safely. Unfortunately, a lot of facilities didn't open too. So that really stung. I know a lot of folks, especially in Parks and Rec, budgets got cut and it's a shame.
It's been a tough year for that group of people. I'm really hoping that we can turn a corner in 2021 and they can start getting back to normal and get hopefully the budgets will come back for them as well.
I hope so. Yeah, I think the way I look at it is, COVID-19 is a unique challenge to 2020, but I hope that by 2021 it's just another risk that we have to mitigate, just like all the other risks that we have to mitigate when we're managing aquatic facilities.
It's certainly teaching all of us and all groups in aquatics, from Parks and Rec to pool companies and property managers and everybody that has a public pool or aquatic facility, what to do here. And yes. It came up very quickly and people didn't know what to do. And we kind of used to it now. We've learned a lot along the way. Things have changed. There's been a lot of changes, but I think that the next pandemic, if we're still alive for it, Craig,
I hope not.
We might be better prepared for it.
I hope so.
Is there anything new with COVID-19 in regards to aquatic facilities?
So I think the latest thing is is a few things, and none of this may be a surprise because I think most people have heard this, but there is kind of a shifting of concern of spread from the droplet spread, which was kind of initially where we started, and that whole 6 feet boundary that we should keep between others. And now there's a concern that maybe it's being spread through aerosols, through finer particles that are hanging out in the air for longer periods of time. Unfortunately, there's not really any data that I've seen to show how dangerous that is. And basically, we just have general guidelines which suggest that if you're in an area that doesn't have good air ventilation, you don't want to spend a long time in there, because especially if it's crowded with a lot of people, because if it's not circulating and somebody is infected, the aerosols that they're breathing in the air, you could breathe in and you could get infected. So that is a concern. And so people are starting to think about their aquatic facilities. How new and how modern is my ventilation system? And that's a good question that we should ask anyway, because I think that all viruses spread in a similar manner. And the kind of the laser focus that we have on COVID-19 now, or the coronavirus right now, is something that I think hopefully we can take and learn what we have learned here and apply it toward other viruses, because I think all these things are positive steps to improving how we operate our aquatic facilities. But ventilation is a big thing. I know I was talking with Sean DeRosa recently, and he was saying that he's seen some people start to do some kind of smoke tests, for lack of a better word. I am not an HVAC specialist, but basically it would involve monitoring or determining what the airflow looks like in your facility by introducing smoke or something that you can visibly see. And where is it going? How long is it hanging out in particular areas? I know locker rooms are a big concern right now, because that tends to be an area where we don't really focus on good ventilation, because we're thinking we're only in there for a short period of time. But that's also where a lot of people come together, and so people can be in close proximity, and air can be stagnant in there. So, and even in some older facilities, that have that burning eye sensation when you walk in, obviously their ventilation is not that great. And so if I were an operator at one of those facilities, I would be lobbying whoever the facility owner is to start budgeting for some ventilation improvements, because regardless of what happens with this pandemic, that needs to happen in that facility. So I would say that's a big thing right now, is just talking about ventilation in your facility, particularly for indoor facilities. A few weeks ago, the definition of a close contact was changed or altered or updated, I should say, by CDC. So that's, if you haven't heard that, I'll read this straight from the CDC website, but it says, based on our current knowledge, a close contact is someone who is within 6 feet of an infected person for a total of 15 minutes or more, starting from 48 hours before illness onset until the time the patient is isolated. So if you are close contact, you should stay home, maintain social distancing, and self-monitor for 14 days from the date of last exposure. So that's a little bit of an update from the previous definition, but that definitely helps give people a sense of, when I should isolate or when I shouldn't isolate, because I would say we have, months ago before this came out, there was a lot of COVID craziness. You'd hear a story like, oh my gosh, my sister's brother's nephew's aunt got COVID. Does that mean I need to isolate? No, when's the last time you saw them? Oh, a week ago, and it was only in passing. And so this kind of really helps put some concrete boundaries around, okay, when am I really at risk? And I think these are good guidelines that are helpful for that, and to kind of manage the paranoia, I'll say, for the lack of a better word, there, just surrounding the whole COVID craziness. And then I think the other thing that is that Sean mentioned to me in our discussion that I completely agree with is that the use of technology has really improved this year. It really has been a focus for improving on how we operate our facilities from the standpoint of scheduling time slots for when families can come and use the facility, and for checking in and out of the facility. So that way, if you have somebody who was COVID positive and was at the facility, it makes it a lot easier for the operator to go back and look and see, okay, who was there during the same time, who could potentially fit the definition of a close contact, and therefore who do we need to contact and advise them of this potential risk that they've been exposed to. So those are probably the newest things, as far as, and that's really, I say new, within the last 2 months, 3 months or so. Those.
Thank you very much. It's good. It's good for our audience to know the new things that may affect them. And you've been talking about COVID, you had a lot of information here. Tell us how your background, how you know so much about COVID-19 in regards to aquatic facilities, indoor, outdoor. Tell me a little bit about you, Craig.
Okay, so I've been an aquatics nut my entire life. I grew up swimming year round from the age of 9 through college, and started my pool management firm about a year out of college. And we currently manage over 250 commercial facilities in the metro Atlanta area. We provide staff to roughly a third of those facilities. Here in Atlanta, there's a lot of, we don't have a mandatory lifeguard requirement. So there's a lot of non-staffed pools, which is obviously a concern during COVID, and how do you manage that as well? So
that's been one of the challenges in Florida as well. We don't have a mandate for lifeguards here as well. So same challenge at all these properties as they contacted us. What do? There's nobody there to monitor what's going on.
Right.
Yeah.
So as I saw, I think like everybody, as I saw this pandemic kind of unfolding, when we thought it was going to be a blip, maybe back in February, March timeframe, right when it was starting, it caught my attention, but it wasn't until probably mid-March before I really started realizing this is going to probably have an impact on our season, and thinking ahead, what do we need to do? So I immediately just started researching, what's available. I do, like you, I have a degree in biology as well. And wrote a research paper on epidemiology of Giardia when I was in college. So it was.
Oh, fun.
Yeah, it was actually, I know, it really was fun. I enjoyed doing that. So, I guess that's my background from the standpoint of just being interested in, what this disease, or what this virus is, what disease it can bring about, and how it spreads, and how we can prevent it, how we can proactively message, what we need to do to the public. And also, I think what I realized there was a really strong need for at the very beginning of this pandemic is just to preach patience, because people were, wanting answers right away. Well, what do we do? What's safe? What's not safe? And, as Americans, as I think, citizens of the world right now, really, we are all used to having all the answers at our fingertips. And when we come across something that is truly the novel coronavirus, novel means it's new. We haven't encountered this before. It's certainly not on a widespread basis like this. So we have to step back and say, okay, we're going to have to slow down. We're going to have to take this step by step and be careful. And I think that definitely prevailed, although there was a lot of people that were rushing to make quick judgment. We had some customers, for instance, that wanted, just didn't care at all. We want to open, and we had to really caution them that this is not a great idea. You've got to put a plan together. And so that's, a lot of what I did was really to kind of help my own customers. And then I realized, okay, this has applicability nationwide. Let's see who's talking about this elsewhere, and got involved in the conversation, and it's been a wild ride this year.
It has. 2020, we're in November, and I can't believe it's the end of 2020 already. And our audience is listening to this podcast. It should be December 2020. Right. So we're almost there, guys.
Right.
And we're recording in November, but going to be in December listening. So we're still in that 2020, hopefully getting better as we head out of it. So what should aquatic facilities do as COVID case numbers rise around the country, Craig?
So that's a great question, Lauren. And I think we have to go to the basics here. We have to, first of all, see what's happening in our communities. This is affecting different communities in different ways. As we saw, early on, the Northeast had a massive explosion up in New York City. And then things kind of quieted down, and now it's kind of heating up again. And it's just, so it's coming and going in waves like viruses and pandemics do. So we need to expect that. We need to be willing to change our approach and be flexible. And I think we need to let our clients, our patrons know that they're going to have to be flexible as well. We are going to do our utmost to maintain your safety. There is absolutely no way that we can guarantee anyone's safety or prevent that they're going to, get this disease get this virus from the facility when they come to our facility. In fact, they're probably not getting it from the facility. They're probably getting it from another patron at the facility. We know that, but that doesn't stop people from suing in this litigious society that we're in. So I know here in Georgia, our government here passed a law called Senate Bill 359 that I was involved in helping promote, and basically offers protection to businesses and operations from COVID-19 liability, so long as you put the sign at the door of any entrance to your facility. It's got to be written in very specific terms in 1-inch lettering that warns anybody coming in that there could be COVID-19 here. Exposure to COVID-19 could happen while you're at this facility, and you must enter at your own risk. I think there's maybe a few other states that have passed a similar law. I think that we're going to see more of that as we head into 2021. I think it's just a common sense thing. And we've got to control the potential legal cost of this pandemic as well. So that's one thing I would say is, even if you don't have that law in your locality or your state, I would still highly recommend posting a sign warning people of the risk when they come in, because as aquatic professionals, we have a duty to warn of risks, and we warn of all other risks. Why wouldn't we warn of this risk, right? It just makes sense.
Exactly.
So I would say signage is really key. There may be times if the situation gets really bad in your location, you might decide you need to shut your facility down for a while. And, but I think I can't make that decision for you. That's got to be something that you make when you look at, can I follow the CDC regulations? Can I and must I follow, or should I follow? Absolutely, you should follow the local regulations. So if your city or town shuts down, then yeah, you're going to have to shut down. So I would just say, keep an eye on that. Make sure, if you haven't already, establish your COVID-19 point of contact for the facility. You need to have somebody who really champions the management of this virus at your facility. They're your point of contact. They're keeping up with all the latest. They're advising you as the operator, what you need to do, and you're counting on them. So
that's a good piece of advice there. Having somebody who's knowledgeable, that can answer questions to the public, that is going to keep up with that if the local health department contacts them for contact tracing, and they can get all that information as quickly as possible to them. They're that point of contact. I think that's a really good idea to give to our audience.
Yeah, absolutely. I mean, I look at it the same as if you had a life and death incident at the facility where somebody had to be taken away in an ambulance. The smart thing to do is to have a point of contact for that. Have a press contact. If you don't want lifeguard Sally answering questions unprepared, and there's nothing that's not faulting lifeguard Sally. I'm just saying that she may not be prepared to answer the types of questions that are thrown at her. And so having that point of contact is very important, and making sure that they're educated. And then that point of contact needs to have members on their team that are advising them. So they need to have an attorney for the facility. Whoever your legal counsel is should be part of your team, helping make the decision if you need to shut down, or if you need to open, or if you need to modify your practices there. Your insurance agent needs to be part of that team as well. You need to have an understanding as the operator of what coverage do I have and what coverage do I not have. I talked about in other, we manage primarily homeowners associations and condos, so that's a little different than Parks and Rec and institutions. Well, it's a lot different, I should say, than Parks and Rec and institutions. But we have, a number of our facilities have volunteers in the community that help with specific duties, especially sanitizing or organizing things, or making sure things get locked up at night, or monitoring bather load and that sort of stuff. So if you're going to deputize people, you have to take into account that there's some liability there as well. And so you need to, again, talk to your insurance agent, make sure that you're deputizing them correctly. They need to be official agents of the board or of the operator, whoever it is, in order for them to have insurance coverage when they're carrying out their duties. So that's a really important.
And just to point that out, that happens a lot because the homeowners associations and condo owners associations, they are limited budget. So they're going to volunteer for anything that they can do, but you got to think about the liability that they have. And I have to assume that properties like that are going to have attorneys on board for just regular safety things that happen in case something happens at their facility. So making sure they understand that that same lawyer they can utilize hopefully for any COVID-19 exposure as well that may happen with a lawsuit at the property. So that's very good for the audience to know. And I think it applies to Parks and Rec and pool companies, you know, because they're on those properties as well. So anybody that's on a property that's taken care of or has contact with anything that may come into contact with COVID-19, this all applies to everybody.
Yes,
So,
completely agree.
So what additional concerns do indoor pools have compared to outdoor pools?
Well, we talked earlier about the aerosolization of the virus, which is one of the more current concerns. So obviously at outdoor pools, which like 99% of the pools that we manage are outdoor pools here in Georgia, we don't have that concern because everything just blows away. But for indoor pools, there again, you've got to check your ventilation. And usually newer facilities, and this is just what I'm hearing. I'm not an HVAC specialist, so you would want to consult with whoever designed the HVAC system at your pool. Are you getting the proper number of air turnovers per code? If you're not, that you're putting your patrons at risk. You're putting your lifeguards at risk, and that needs to be looked at very strongly as far as upgrading. And needs to be a priority. So that's probably the biggest one.
Indoor pools are going to be open more than the outdoor pools up north. So there's going to be a little bit more concern with the amount of time of exposure. Even though it's snowing outside, people can go to their local fitness club that has an indoor pool and do their lap swimming. And so, there's going to be increased risk still for those particular facilities that are going to try to stay open. I mean, up north, most of our outdoor pools are winterized now. So some of that risk is minimized on those aquatic facilities until we get to late spring.
Yeah.
Now, if we're in the Sun Belt, a little bit different because our people down in these southern states, they're swimming all the time. And we have visitors that think with no snow on the ground, I'm going swimming. It's warm.
That's right.
We have a lot of Canadians that come down. They're lovely people, come down to Florida, they're swimming. So in certain states, and like you said earlier, it depends on where you're at, what and the time of year and how much exposure we're going to get. Yep. And if people are using the facilities or not. So if cases are increasing in your area and you're in a northern state, it's probably you're not going to be worrying about your outdoor pool right now. It's going to be your indoor pools if we're talking about aquatic facilities. So that's a very good point that you brought up with indoor pools. Because a lot of people they just think of pool and they don't think about indoor versus outdoor and that there are differences. You can't treat every pool the same in every situation.
Absolutely not. And with indoor pools, it becomes even more critical that you're managing your patrons as far as social distancing, because those droplets and the aerosol is not going to blow away as quickly, even in a well-ventilated natatorium. Yep. But
no possible UV radiation from the sun breaking the virus down, which can happen. Mm-hmm. So
certainly that helps. I think also with surface disinfection too. Outside you've got the UV rays of the sun hitting the surfaces as well as heating up those surfaces and drying them out, where that doesn't happen when you're indoors and all the moisture is trapped inside.
And I know this is a rehash and people know this a lot already, but just to, anybody that's new in the audience, what's the minimum chlorine level in the actual pool water that will actually kill COVID-19 so we can alleviate any concerns with new listeners?
I think it's actually, I haven't read it in a while. I think it's really low, like 0.5, even drinking water, which I think has less than 0.5, will also, it's shown that it doesn't really survive in there. So it just doesn't survive in water in very well in general. So,
it's not really a recreational water illness. It's
right.
more
No, it's not.
contact surface and aerosolization when people are coughing and sneezing, hence
Yeah.
the face mask. So what are the big concerns for our new listeners that they should be looking at with
So,
COVID-19 in aquatic facilities?
well, let me go back one to that previous question too, because I wanted to also talk about mask wearing. I know that's been a big thing. So for indoor pools in particular, you may have to modify your mask wearing policy. I know here in Georgia, we didn't really enforce mask wearing for outdoor pools for guests. And I think we would have gotten a tremendous amount of pushback if we had. So we chose not to wage that battle. But for indoor, I think, you have to consider what is the ventilation like in there. Do you want to have your patrons wearing masks when they're not in the pool? Of course, we don't want them wearing masks in the pool. And then your lifeguard staff, in an indoor pool, it probably makes sense for them to be wearing masks. And it's also important for you to train your staff on how often they should be changing their masks. They probably shouldn't be wearing their masks for, weeks on end, because bacteria is going to grow in the masks and they can make themselves sick from mask wearing. We've already had cases, I think, where that has happened. So we want to, educate our staff that when they're wearing masks, that they need to be wearing clean masks and changing them or washing them daily. And then let's see, your question was,
what are the things that our new listeners that are listening should be concerned about? If they're new, just got hired in a Parks and Rec, or they're new for a pool company and they haven't really understood the concerns specific to aquatic facilities. It's kind of a rehash. I know it's a lot of us that have been dealing with COVID-19 and aquatic facilities kind of know it already, but let's just go ahead and for the new listeners, what are the primary areas that they should be concerned about with COVID-19 and their aquatic facility?
Well, ultimately, the water, like we said, the water is not where the concern is. As long as you're maintaining your parameters where they're supposed to be, you don't have to worry about the water. What you have to worry about is close contact between individuals. So making sure that family units are staying together or not intermingling with non-family units. So really monitoring the social distancing. And the disinfection of surfaces is kind of a big thing. That was a really big concern at the start of this. I think it has, I don't want to say taken a back seat, but it kind of has taken a back seat. I
feel it has too. I don't hear it as much. In the beginning, it was what concentration or what type of chlorine that we can mix if we run out of chemicals. Can we use regular household bleach or pool grade bleach or what? Yeah. Yep. I feel that's gotten a back seat as well.
Yeah, so I think as the science has developed and learned more about this virus, we see that it just doesn't last very long on surfaces. So it's not the primary means of transmission, as the CDC has confirmed as well. So that we can feel good about that, because I think as a facility operator, it's a very daunting task to think I've got to be wiping stuff down every few minutes or watching who's touching what, and it's a bit overwhelming. So I think we can take a breath there and say, okay, yes, we need to disinfect surfaces regularly, but we should be doing that anyway. We should be doing that. Oh
yeah. There's always stuff out there.
Right. Not just coronavirus. So, I think for us, for my clients, a big topic was, what do we do with the furniture? Do we put our furniture out? Do we not put our furniture out? Because that's relative to the surface cleaning as well. A lot of our clients went with the bring your own policy. And then those clients that decided to put their furniture out, what they would usually do is they would have people wipe it down between times, and they would set between usage, and they would set their furniture up in pods, and there'd be markings on the deck to separate it out. So that's, to answer your question about somebody new coming into aquatics, how does my pool look differently than it did the year before? It looks quite different. You may have no furniture on the deck. You may have a very sparse amount of furniture on the deck with lines drawn, and you may have people walking around, in masks, and you may have a lot fewer people at the pools. I think what we found was most people were pretty respectful. I think another important point too is to make sure we're not putting too much burden on the lifeguards. The lifeguards' primary responsibility has to be patron surveillance and the ability to do that. We can't expect a lifeguard to know, okay, well, that's Johnny and that's Bobby, and yeah, they're not in the same family, but they're next door neighbors and they've been playing together throughout this entire pandemic. And maybe it's not a big deal if they're, playing Marco Polo in the pool, whereas, you got other people that
Right.
haven't been exposed to each other. So there's no way a lifeguard's going to know that. So that's really a difficult task. So I think
Their training is primarily for drowning prevention and,
Exactly.
and saving and life saving at that point. So, and
Yeah.
you and I both know we've been in the industry long enough. Drowning isn't what you see in the movies. And I have a whole drowning podcast series I have coming up
Cool.
for everybody that's listening. So kind of this is a little segue into introducing that coming up down the road if anybody wants to continue listening in the months coming. But, I agree with you. Their primary concern isn't going to be COVID-19 right now that we're talking about. They're going to be worried about that 0 to age 4 child that, the leading cause of death of that age group is drowning. And drowning is silent and you don't hear it. So, I agree. We need to make sure our lifeguards can do the primary job that they have. What programming considerations should aquatic facilities think about now at this point right now in COVID-19?
Yeah. So that's a great question. I think a lot of people, a lot of facilities said, well, we're going to have to stop everything except lap swimming. And that was, that was kind of a knee-jerk reaction. And I think lap swimming is probably the easy go-to as far as controlling social distancing. I mean, you've got lane lines, you can put one person per lane, so that's relatively easy. But I think, people are going to want to use their facilities for more than just lap swimming. So you can start with lap swimming, but, you're going to have other groups that are going to want to get in and start using the pool. You're going to have swim teams. We've already started, high school swim team season. So the high school teams are wanting to get in the facilities. So basically, I think you need to be thinking about a number of things there. First of all, U.S. Swimming has the best guidance that I've seen as far as how to operate your swim team safely. So I would just refer you to their information there.
That's awesome.
How to minimize. What's that?
That's awesome. Thank you.
Sure. On how to, what you want to do is control the number of swimmers in the lane, and they have some great strategies in place there. But let's see what else. Ingress and egress from the building. So if you can, try to have a different entrance and a different exit to minimize the people coming into contact with each other as they're going in and out of the facility. But when you do that, you also have to keep in mind the safety of everyone coming in and out of the facility. If in order to have a different ingress and egress, you have to have people going out the back alley entrance, at 9 o'clock at night when it's pitch black and there's nothing out there but a dumpster, then maybe that's probably not the best point of access or ingress or egress to you. So I've seen that in one case where, a facility was trying to do that and they were actually putting the swimmers at risk, having them going through an area that wasn't monitored and wasn't well lit. Somebody could have fallen and gotten hurt. Or, God forbid, there could have been somebody back there with nefarious purposes in mind. And let's see, swim lessons, people have been, I'm a huge, and I think you are too, a huge learn to swim advocate,
yes.
Water safety advocate. So swim lesson programs have really taken a major hit throughout this pandemic. And I feel for them, and I want them to get back to full capacity as quickly and as safely as possible. I think you've got to consider the possibility of spread between your students and between your instructors and students. And so, face shields is what I've seen most instructors using now, the plastic face shields, not face masks. We don't want people with face masks in the water per se, especially if you're having to put your face in the water, because that is not meant for that.
It becomes dangerous at that point.
Right. And depending upon the level of the swimmer, some instruction can be done from the deck. If you're doing higher level coaching, most of that can be done from the deck. So, and that at that point, maybe the coach is wearing a face mask. and the swimmers are just doing what he or she is asking them to do.
So the more contact may probably happen with the lower age groups of swim lessons, where you got the
Correct.
mommy, baby, and me.
Right.
Versus, and maybe the instructor wears that face shield, they're in the water, and they are really instructing the parent on what they're doing for the majority anyway. And then have
Correct.
them all wearing face shields or something like that as well. That's appropriate.
Yeah, the parent and child, mommy and me or daddy and me class is really ideally suited for the pandemic. But once you get above that level, then you've got those challenges of how you're going to manage that. And I think there's been a reluctance of a lot of parents to sign their kids up for group swim lessons. So I think because you're going to have more exposure to kids you don't know. So private lessons, there's maybe been more interest in, but still, I think overall the swim lesson industry has taken a hit, and I'm hopeful that we can. I haven't heard. The good news is I have not heard of a single outbreak of COVID-19 related to an aquatic facility of any type.
That's a good sign.
So,
I do know that I had listened to a presentation. Florida Department of Health in Florida monitors the drowning rates here and keeps the data. And I had seen a presentation from them that they can't say for sure, but they did see an increase in drowning rates since COVID-19 started. So there is a correlation between COVID-19 and the lack of swim lessons happening, but also more kids swimming during that time period as well. And it was the spring into the summer. We'll see the drowning rates drop as the pools up north have closed, but Florida being a year-round state, we could see the same level all year in that drowning rate. So they do feel that there was possibly an increase in drowning rate due to COVID-19. And again, like I said, it has a lot to do with more people using their pools at home. It's not public pools. Right. It would be private pools, anything like that. More people were using their pools because they were quarantined to their house or anything like that. Any other programming considerations for aquatic facilities or?
I think with your staff training, you have to think about the, we'll say Red Cross and Starguard have put out some really fantastic guidance as far as conducting lifeguard training classes as safely as possible. I know that was a huge concern as we headed into the spring, where recruiting stopped, and then once recruiting was able to pick back up again, we said, okay, now we've hired these people, but how are we going to train them safely? There's just simply no way that you can perform physical rescues on people in the water without coming into close contact with them. It's a physical impossibility. So I think that there's some good practices there. I think you just have to do the best you can to minimize those close contacts, and having a 1-to-1 ratio of student to mannequin is good. When you're organizing or setting up your in-service training for your lifeguards, keeping a COVID-friendly practices there. This year, when we did our in-service trainings, we broke them down into smaller groups, whereas we used to do really large groups, and we're trying to, minimize so that if somebody did come to in-service and was infectious, that at least they would only expose 6 or 8 people in their group as opposed to the 50 people that were there for in-service training.
That makes total sense. And then you can also follow up with contact tracing very easily when you know who's had contact with who.
Right.
Which kind of leads in, is there any other programming considerations that you have?
I think, and I'm not an expert in this field, but I know that, water aerobics is also kind of taking a hit because you have a lot of people, in the pool in a close proximity and they're breathing, so I think that's, I don't know who's got good guidance on that. So I would love if there's a listener out there who is involved in that and knows where to find good guidance on how to work out in the pool with water aerobics. That would be great. And then I think water polo is the other sport that's also really taken a hit because that's a close contact sport in the water. And I've pretty much seen those activities at the facilities that I go to. Those activities have pretty much stopped. because I don't know of a way to do it safely. But if there's somebody out there with guidance, I would welcome that.
Contact Craig.
Yes.
He'll put a whole training together.
I have not seen it yet, and it's not my area of expertise, but I'd love to learn. It's good stuff.
So how has contact tracing changed recently?
Well, that kind of goes back to, I think, what we had started when you asked me about what's new. And so the CDC is following their new definition of who's a close contact, which has been helpful in nailing that down.
Yeah, and that's what the health departments locally are going to be using they always follow CDC. So as that definition changes, they're going to change how who they're contacting, how they're contacting, time period. Right. They're going to follow CDC. Yep.
That's correct. Yeah.
All right. That was an easy question.
Yeah.
So I know you've done a lot of it, training from when this started.
Right.
Other than our podcast right now, how could our listeners get some of this information from you?
Great question. So the most recent seminar that I was involved with, or webinar, I should say, was at the WAC, the World Aquatic Health Conference, a few weeks ago. And that was entitled, I think, Managing COVID-19 Risks in Aquatic Facilities. And I was part of a panel. I think there were 4 people on that panel. So Sean DeRosa was on there, Michelle Hlafsa, and
we love Michelle.
Oh yeah, Michelle's wonderful.
CDC.
Yes, and there was another lady on the conference that I'm completely drawing a blank right now, but she's from the health department in, oh goodness, I can't remember which state, but she provided a health department perspective. All of it was, I mean, that would be probably the best resource I can refer people to if they want to go to the WAC. I think you might have to subscribe or pay something to be able to watch the videos there, but it's a really good video. And then there's also the videos that I did back at the beginning in April and May. Those are posted right now on the property management company site that I partnered with when we did that. But we're working on putting the link up on our own website, but we're in the process of redesigning our entire website. So that'll be up probably within the next month or so.
It'll be a little bit challenging, but how can they contact you by email?
Oh yeah, my email's super simple. It's just craig@searspool.com.
So they can email you. Maybe you can email a PDF of the PowerPoint or anything like that, so that they can have some written information. Because I know you've got a lot more than what we've talked about today. This is just our short podcast episode, trying to do a few updates and stuff. But if you want definitely more detail, and I would think that the one from the World Aquatic Health Conference would be the better one because it's the most recent one you did. So it would have all the more recent updates and that kind of thing in it. So if they can watch that, or you have anybody in the audience actually attended, they have a certain amount of time to be able to listen to that video. So if you did listen to his presentation and you went to it like I did, and I listened to it, it was very good. Go ahead and do that. So I want to thank you. Anything you want to add that we didn't talk about, Craig?
Gosh, I think that, I'm very passionate about aquatics. So I think that we have to remind ourselves on a regular basis that despite the insanity that is 2020 and this pandemic, that we still work in my opinion, it's the best industry of all. But we work
I agree.
We work in this amazing industry where every day our job is to provide facilities for people to come and recreate. It's fun and safety, combined together in a family type environment. And in my mind, it just doesn't get any better than that. So, we've got our challenge is to serve the public in a way that creates better health. And that's, physical health, emotional health, mental health, and the water achieves all of that. So it's such a powerful industry to be part of. So I know we're heading into the winter, and it can be kind of depressing with the numbers going up on COVID-19 and all that. But we work in an industry that is just amazing. It does amazing things for people, and we should be proud of that. We should hold our heads high, and we should accept the challenge of what this pandemic has given us. And I really believe that aquatics is going to be seen as as kind of the industry of the future, because it's just not going away. People are not going to get tired of spending time in and around the water. People love to be in and around water. So our job is to make it safe and fun. So how awesome is that? It's great job security, and it's a job you can really feel good about at the end of the day. So I encourage people to be excited about the industry that you're in.
I totally agree. I'm so excited. This industry has been doing well. I know we talked about Parks and Rec is the one group, and I really hope that budgets come back and things, get better for them. But overall, the industry has really done very well during a pandemic.
Mm-hmm. Yeah, if you take a look at, on the construction, my friends in the construction side of things have just gone gangbusters. And we're seeing that all across the country. New pools are being built at record rates. So that just means good things for the industry.
Right. And as COVID is still here and we don't have a vaccine, we still have to deal with it. We have more pools going in the ground in people's backyards. Public pools are still being built for new homeowners associations. So it's still a very valid topic until we get rid of COVID to a point where the numbers aren't going to be what we have right now. So no matter what, we still have to be aware of it, what to do with it, what are the best ways we can minimize it. We're not going to get rid of it until it decides it's gone.
Right.
But it's about trying to continue to enjoy it, because it is like really the most healthy activity for people to do. So they're going to do it regardless. So we need to try to figure out how to make it safe during COVID-19.
Amen.
Well, thank you for being on my episode today, Craig. It was wonderful having you. And
thanks for having me.
You stay healthy and safe during this time.
All right, you too. Take care.
All right.